Support for On Point and the following message comes from Rocket Mortgage by Quicken Loans. Lift the burden of getting a home loan with Rocket Mortgage and get a secure, transparent home loan approval in minutes. Skip the bank, skip the waiting, and go completely online at quickenloans.com/onpoint.
From WBUR Boston and NPR, I'm Tom Ashbrook, and this is On Point. Everything on the line today for House Republicans and American health care. They've pledged for years to repeal the Affordable Care Act, Obamacare. They've got the majority. They've got the White House. But this week they ran into a real tangle over getting the votes and big questions over what kind and quality of health care they would give or deny the American people. This hour On Point, the House and American health care. You can join us on air or online where this conversation is always on. Have you been calling your member of Congress on health care to say what? Join us anytime at onpointradio.org or on Twitter and Facebook at On Point Radio. It's been a full court press this week. Here was the president on Capitol Hill on Tuesday saying the bill was getting better and better. Republican lawmakers coming around.
We had a great meeting, and I think we're going to get a winner vote.
What do you think?
We're going to have a real winner. It was a great meeting. They're terrific people. They want a tremendous health care plan. That's what we have, and there are going to be adjustments made, but I think we'll get the vote.
Win, win, winner. And here Paul Ryan on Tuesday saying this is the time. This is the time to act.
The president just came here and knocked the ball out of the park. He knocked the cover off the ball in explaining to our members how it's important to unify, how it's important to work together, how we are advancing our principles, and we are doing what we told the American people we would do. This is our chance, and this is our moment. It's a big moment.
But here, Jim Jordan, House Republican from Ohio, telling MSNBC's Morning Joe yesterday the only thing worse than doing nothing about health care was doing the wrong thing.
We actually think this is the wrong piece of legislation. Ask yourself a couple fundamental questions. Does it repeal Obamacare? No, it doesn't. Does it unite Republicans? No, it doesn't. Every major conservative group's against it. You got senators opposed to it, House members opposed to it. It doesn't unite Republicans. And does it, most importantly, lower premiums?
Wow. So here we are. Joining me now from Washington is Noam Levy, national healthcare correspondent for the Los Angeles Times. Noam, thank you very much for being with us today.
Good to be with you.
And with us from Washington is Mary Agnes Carey, senior correspondent for Kaiser Health News. Mary Agnes Carey, thank you very much for joining us.
Thanks for having me.
So, Noam, we will have people listening to this show at many different times throughout this day, which is a little awkward because this thing is rolling, and it's rolling in a pretty hairy way right now. As we speak, how's it look for passage of the bill, and is the bill yet nailed down?
So the answer to your second question is no. We have not even seen the language of the revisions that are being discussed by the leadership in the White House. There are meetings scheduled today between the president and some of those conservative lawmakers who have been most resistant to earlier versions of the law. So I think everybody right now is trying to figure out not only whether the votes are there, but what even will be voted on potentially today.
I was seeing Eliana Johnson earlier, a reporter saying it's panic time, quoting GOP members of the Congress saying it's panic time. Mary Agnes Carey, is it clear what's up for negotiation here today? And I assume not everything, right? I mean, there's some things that there's a general agreement on. What's at the heart of the tussle now?
Two of the areas they're looking at that they might change that have been in the bill are keeping something called the essential health benefits. These are 10 categories of coverage. They include things like mental health services and emergency care, pediatric, maternity services, that kind of thing. There are some concern from conservatives that this is overly prescriptive. They'd like them taken out. Even if that could pass the House, and that is very much in question, they're going to have problems with that in the Senate. And there's been some suggestions even of taking out this provision that is wildly popular that's in the Republican AHCA replacement that would allow adult children up to age 26 to stay on a parent's health insurance plan. The movement to get conservatives is to try to take some requirements out of the bill. But again, you're going to hit problems with moderates in the House on that, and you are also going to hit a lot of problems in the Senate. So there is a lot of horse trading now. because, as we know, they're trying to get the votes to pass this thing. So things, as you noted, are moving extremely quickly.
Noam, what is the fundamental philosophical debate here? Or maybe it's fiscal, or maybe it's just political. But let's start with philosophy within the Republican Party about what to do with American health care.
Well, stepping back for a minute, the primary criticism that Republicans have leveled against the Affordable Care Act for 7 years now
long time.
is that it extends government regulation and interference in healthcare markets too much. And the corollary to that is that it also spends a lot of money. The money, we should be clear, is paid for with taxes, but that doesn't make it any more popular with Republicans. And so when Republicans came to power, the driving force this year behind their repeal effort has been to scale back what the Affordable Care Act does and what the federal government does to provide health insurance and to ensure that the coverage that Americans get meets a certain minimum standard. That was a core part of the Affordable Care Act. But the problem and the conundrum that Republicans find themselves in is that it turns out that many of the protections that the Affordable Care Act extended are quite popular. People like having health insurance coverage. The law itself was never that popular for a number of reasons, many of which had nothing to do with health care. But the protections themselves are popular. And when you start talking about taking away health insurance or taking away the essential health benefits that Marianne has talked about, these are difficult questions for Republican lawmakers to go back to their constituents and talk about. And so there's this tension on the right between a commitment to restraining government and a political imperative not to anger too many of your constituents.
And they're going to have to go back and face those constituents at some point. The Freedom Caucus, very conservative, has been right at the heart of this, resisting. Republican Congressman Mark Meadows heads the Freedom Caucus, talked with MSNBC last week, and you can hear, this was after the CBO, the Congressional Budget Office, came out with some of the tough numbers on what this American Health Care Act would mean. You can hear the tension as he struggles with how to replace Obamacare.
The CBO score recently talked about lowering premiums by 10% over 10 years. But if you look, for the vast majority, those 40 and older, actually premiums go up. And so for me and the people that I serve, I've made a commitment. I'm not going to take one program that is not working well and replace it with another one that potentially won't work well. We've got to do better on the replacement side of that.
Mary Agnes Carey, where do you see the fiercest resistance then? Is it from the Freedom Caucus and the arch conservatives who really want to get government more out of health care, or is it from moderates who are worried about political backlash in their home districts if seniors' premiums start going through the roof and so on?
I see it as sort of this big balloon. If you try to satisfy Mark Meadows and the Freedom Caucus, if you try to really give them what they want, then you're going to lose votes with the moderates. I mean, it's this sort of horrendous sort of seesaw effect where they're balancing political messaging that they've done to their base, that they want a full repeal of the Affordable Care Act. Then there were Republicans in not only the House and the Senate that say we don't want a standalone repeal. We want a replace package right away to assure people we're not going to leave them high and dry if they have coverage. And it's this incredible balancing act because most of the focus has been, and rightly so, on the Freedom Caucus. They control about 36 votes, and they have been the most adamant, the most public, saying we can guarantee right now that this bill is not going to pass. But that said, as the package theoretically moves further to the right to satisfy the Freedom Caucus, then you get moderates like Charlie Dent, who runs this thing called the Tuesday Group. He's a Republican from Pennsylvania who walks out of a room and saying, well, I'm growing concerned now because of what they're doing to appease the Freedom Caucus. So this is an incredible, delicate dance for Paul Ryan, the Speaker of the House, who's trying to appease these two different wings of his party and to get this package to the Senate where everyone knows it's going to be changed anyway. It's just an amazing thing to watch.
I mean, Noam, it's one thing to object philosophically when it's just one great big target. But once you start getting into it and the American people start paying attention to the details, it gets trickier. If they go in and try and take out the essential health benefits that Obamacare required in health insurance and health coverage, I mean, pretty soon could Americans be ending up, yes, I've got insurance, but no, it doesn't cover an emergency room visit or hospitalization or maternity care or pediatric services?
As inconceivable as that may seem today, before the passage of the Affordable Care Act, those kinds of holes in insurance coverage were pretty routine. And that was one of the reasons why the architects of the Affordable Care Act were so insistent that one of the things the law would do would be to set a floor to say that health insurance must cover these basic set of benefits. I'll add one additional layer of complexity.
Okay.
Sorry about that. And that is that when you have this system of essential health benefits, that's part of this entire package of consumer protections, again, that are pretty popular. People like being able to get coverage if they're sick. They like being able to know when you have coverage that you're not going to hit a maximum medical bill that your insurer is going to cover, an annual limit or a lifetime limit. Those things are all tied together. And interestingly, if you start taking out essential health benefits because of the way the law is written, you may lose some of those other protections as well, like the cap on lifetime and annual limits. So the president himself noted this a few weeks ago. Who knew healthcare is complicated? That's part of the challenge that Republicans now have.
Mary Agnes, I mean, this could go long today. And again, depending, dear listeners, when you're hearing this, we don't know exactly how it's going to transpire during the course of this day, but we're trying to lay out the fundamentals here. Might we be grappling over major elements of American healthcare deep into the night here, sort of, on the fly?
Absolutely. I don't think they're going to open the vote. They're not going to schedule the vote until they know they either have it locked down or it's close. So this could happen. If things go well for them, they could do it this afternoon, but it's more likely we are going to be late tonight, early into the morning, and no one may remember this as well. When the House of Representatives passed the Medicare prescription drug benefit, Republicans were in control then and created that. Typically, the floor votes last about 15 minutes. That was held open for 3 hours, from about 3 to 6 in the morning. I was there all night that night, and we could have another situation like that where, it's sort of this. It's the leverage, right? If you are the people want something in the bill are pushing because they know the leadership wants a vote, and leadership is pushing them too.
I'm Tom Ashbrook. This is On Point. We're talking this hour about House Republicans putting it all on the line for the American Health Care Act, looking at what they have hammered out today. You can join us this hour. Republicans, what do you see unfolding here on Capitol Hill today? Will Americans end up with better health care or ideological purity with worse health care? Are the compromises being made over this bill the right compromises? And all listeners, do you know what you stand to gain or lose with this bill? Could you be one of the extra 24 million people projected to lose coverage with the bill, at least as it has stood? Mary Agnes Carey is with us. She is senior correspondent covering healthcare reform and more for Kaiser Health News. Noam Levy is with us, national healthcare correspondent for the Los Angeles Times. Think back to Donald Trump in the campaign. Here he was in the fall of 2015. Candidate Trump talking with 60 Minutes, Scott Pelley, about his initial promise for what would happen after he would repeal and replace healthcare, how good it would be.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
Okay. Everybody? Well, the Congressional Budget Office says an extra 24 million people would go without. Much better care than now? Well, we're talking about dropping essential healthcare elements out as requirements for American insurance, the insurance that Americans would buy. Earlier this week, we had the Republican Senate Majority Leader Mitch McConnell saying, well, Donald Trump, this president has the right skills to help Republicans work together on healthcare.
I think the president's attitude is similar to mine. I want to get a result. And in order to get a result, you have to be flexible on the various component parts, because you have different members who are saying, I need this or I want that, and that's the legislative process. I think he's got the natural instincts for the legislative process because he's a deal maker.
He's a deal maker, but this is a big, difficult deal, and the consequences for individual Americans and for the country as a whole, just enormous. Noam, Mary Agnes, please stand by. Cynthia's calling from Fort Lauderdale, Florida. Cynthia, you're on the air. Thanks for calling.
Hi. Yeah, so it's clear to me that there's just a very
ideological difference between conservatives and liberals when it comes to healthcare. Conservatives believe that healthcare is a commodity and not a right, and liberals have the opposing view where basic healthcare should be a right and not a commodity. So it's confusing to me when I hear a lot of these Republicans, moderates or even from the Freedom Caucus, say that we are doing this to help the people. You see it across town halls across the country. People want to keep health care. They're worried about losing their health care. So when I hear more Republicans or conservatives say we want to help the people, what I'm thinking is that since they believe that health care is a commodity, the people that they're referring to are big insurance companies and not actually the people, the average citizen.
Cynthia, I appreciate your call. Mary Agnes, what do you think of that summary of the philosophical roller here?
Well, I think Cynthia's nailed it. I mean, there is definitely a split between Republicans and Democrats over not only this healthcare law, but how healthcare should be handled. I think that many Republicans feel like they want to get any kind of government regulation out of the healthcare system, that the market will take care of itself. You shouldn't be required to have health insurance coverage. As we know, the individual mandate that's in the Affordable Care Act, a requirement that most people get insurance or pay a fine, would be gone. And that philosophical split is there. As Noam laid out earlier, that when the ACA passed in 2010 and was crafted, there was a lot of concern about correcting problems that proponents of the law saw in the individual market, and the essential health benefits and no annual limits, no lifetime limits came through, kids up to 26 on your health insurance plan, all these sort of things they wanted prescribed. They wanted in the law. So there is this division. It is a philosophical division, but as we know, these policy outlines have great impacts on people.
Noam, what is the insurance industry saying about this? I mean, in the end, their mandate is to make a profit, and the biggest profit they can. But, they put a lot of insurance out there. Do they think that they can cover Americans with good insurance without the kind of structure, and I mean more Americans, not fewer, without the kind of structure that Obamacare brought in?
Well, I think it's important to understand that the insurance industry is not monolithic. I mean, most industries feature a fairly broad range of participants. The insurance industry, I think, is even more so. There are some very large investor-owned insurance companies who have been very unhappy with the Affordable Care Act. They profited fairly nicely under the previous arrangement and have had no particular love for the ACA. Some of the more regional and local insurers, I think, have made a try to extend coverage, and many may surprise some people, but there are a lot of people who work in health insurance who do believe that it's worth covering people. So there's a fairly broad range of opinions to answer your question.
Let's go to Janelle calling from Boston. Hi, Janelle. You're on the air. Hello, Janelle. Are you there?
Yes. Hi. Can you hear me?
Loud and clear. You're on the air.
Hey, Tom. So I'm an independent here in Boston. I lean sometimes, to the Republicans because I tend to lean a little bit more libertarian.
Okay.
And to be honest, I think the president and the leadership really should listen to members of Congress and, doctors like Rand Paul, who are advocating, consumer-driven free market solutions to healthcare costs. Cross-state competition, the freedom to associate, to purchase healthcare, and not more increase in government involvement, bailouts for insurance companies, and huge tax breaks for the wealthy. It's a bad bill that doesn't have tangible answers to the problem, which is an increase in premiums, increase in healthcare costs. The Republicans will face the music when, the healthcare debt spiral.
Janelle, I'm sorry, but you're breaking up pretty badly on us. Mary Agnes, if we go to more market-driven, open it across state lines, do you see American citizens, including Republicans, ending up happy with what they've got?
Well, the issue is that some of these things have been tried and not worked out as well. For example, selling health insurance across state lines. It's currently allowed in about 3 states. We have a video on our website, khn.org, that goes through this. And insurers haven't been really chomping at the bit to do it. Part of it is the difficulty in setting up networks in other areas. And then also, there's a great concern about kind of a race to the bottom, if you will. If you are in state A and your employer or you buy insurance in state B and you have a problem, your health insurance commissioner may not be too interested in taking care of it because the insurer is not in your state. and then you try to settle it with the health insurance commissioner in the state where you bought the health insurance, and you're not a constituent there, you're not a state resident, so that may be an issue. So it's sort of this thought that if you allow it across state lines, who is the regulatory body? Where do consumers go? And will there be kind of a race to the bottom where employers, for example, will buy from a distant state that doesn't have any regulation, and you're the employee, and you dealt with that. So these things sound good in principle, but when you start getting into consumer protections, solvency requirements, some of them are really going to be they may be more difficult to pull off than you think.
Republicans, a number of them saying, look, GOP, we promised to replace Obamacare, and we've got to do it now. We're going to be in trouble at the polls. This is Republican Congressman Blake Farenthold of Texas speaking with NPR's Morning Edition today.
My message to my colleagues, whether they're to the left of me or to the right of me, is you ran on repealing Obamacare. If you can show me a path that's going to get us there other than this, I want to hear it. And none of them have been able to come up with a path to getting rid of it other than this bill that the president says he's 1,000% behind and that's going to come up for vote.
But Democrats unanimously against this, fiercely critical of it. This was Oregon Democratic Congressman Earl Blumenauer talking with MSNBC, saying the House Republican proposal would raid Medicaid money, it would destabilize insurance rates, it would raise costs for consumers.
It's going to increase deductibles and premiums, and especially seniors from 50 to 64 are going to pay more. There's no comparison between the disaster that they want to give the American public and the success of the Affordable Care Act, which a majority of the American public actually want to maintain.
So what will it be? As we speak, House Speaker Paul Ryan pushing back his weekly press conference, now pushed back to mid-late afternoon, scheduled for this morning. There are issues as this thing unfolds today. NBC reporting at this hour, 30 or so Republicans opposed or strongly leaning against the House bill that the president says is a must-pass. Andy in Jackson, Tennessee. Andy, you're on the air.
Hi, Tom. Thank you very much for taking my call.
Yes, sir.
I'm 56 years old. I'm a truck driver.
All right.
And my wife works in healthcare. And we both together make a little over $100,000. And the way they're making this Healthcare Act is I'm going to be spending 3/4 of my paycheck for health care. I won't be able to make my house payment or buy food. I've put a lot of money into Medicaid. I put a lot of money into health care over my years of working. Mm-hmm. And they messed up Obamacare, as they call it, by not taking the Medicaid expansions and making all our rates higher and making it where the insurance companies can say they are not making enough money. They have to be making money, but they're saying they're not making enough money, so they drop out. They're just messing everything up, and they're not doing what they promised. I didn't vote for either candidate, and this is the first time in my lifetime I didn't vote for president. And now I can point like they pointed to me because they knew I voted for Obama. I can point at them saying, "You voted for this lunatic."
Andy, we hear the fear right there, and I appreciate your call. I mean, regardless of politics, Noam, this starts to come down. It gets right into people's lives and the quality of their health, and certainly the quality of their health care. Andy's afraid at age 56, truck driver, wife works in health care, that they could be big losers here. As offered, and we'll see what changes come, but as offered, who would be the winners and losers in this change from the Affordable Care Act to the American Health Care Act, that is Trump Care, if you want, or Ryan Care?
So the big losers would be people like your caller and people who depend on the healthcare safety net. 70 million Americans currently use Medicaid, makes it the largest insurance program in the country. And these are poor children, they are pregnant mothers, they are disabled Americans, and people may not realize, but there are a lot of elderly Medicaid beneficiaries who are in nursing homes. Everybody thinks that when you turn 65, you get on Medicare. That's true, but Medicare doesn't pay for a lot of things. So if you're a low-income senior and you need nursing home coverage, Medicaid covers you. So the kind of cuts that are being envisioned by the House bill are truly unprecedented. And I say that not to be partisan one way or the other, but merely to note that cutting nearly $1 trillion out of federal support for Medicaid over the next 10 years it's gonna have an impact. The Congressional Budget Office, which lawmakers rely on to judge the impact of laws, estimates that, as you noted, 24 million fewer Americans would have health insurance. And that's in large measure because they will not be able to afford health care. And so that's a fundamental problem. There are also people who are going to be older, even folks who are making as much as $100,000 who are going to have a hard time affording health insurance under this bill. So this is sort of the underlying tension. And one of the things that's interesting when you listen to Republicans talk, and you played some of these clips, there is increasingly a shift in the way that the president and others have been talking about this health care bill. And it's not so much we're going to take care of everybody anymore as it is we made a promise and we have to keep this promise and we need to stick together. I think that's an important thing to keep an eye on as we go forward about that rhetoric and whether or not the people who are making these laws are thinking about the impact it will have on Americans.
Mary Agnes Carey, $1 trillion out of Medicaid, that's a lot of money. Is this about fiscal issues, for conservative Republicans, is it about savings to the Treasury, or is it about, again, this philosophy that Americans should be on their own?
I think it's a lot of 1 and 2, and partially perhaps number 3. There's a lot of concern that the Medicaid program, the Republicans and President Trump want to give states more power to decide, in some cases, who's covered, what the reimbursements are, what the services are. They're looking at things like a block grant, a set amount of money that would give governors much of that leeway to determine what services they cover, for example, and who is covered. A lot of that is now prescribed in federal law. There's also something.
I mean, there'd be more power, but less money ultimately, right? Because they're capping.
That's right,
what they
less
would
money.
give.
But there are Republican governors that are okay with that. They say that's fine, and whether they go the block grant or they do a per capita cap, which gives them a little more money, the thought of shifting that to the states and letting states control that. And it's going to be, as Noam has laid out, it's less money. It's going to be a cost shift to state governments, perhaps to individuals. It is a radical change in that entitlement program that we have never seen before.
Samantha in New Orleans. Thanks for calling, Samantha. You're on the air.
Hi, Tom.
Hi.
Thanks for having me.
Yeah.
I actually want to answer your very first question that you opened with.
Mm-hmm.
I have actually been faxing my senators using an app. I'm not pleased by the name, but I found it's a really useful app. It's called ResistBot. And what they do is they text you on a daily or every other day basis to remind you, hey, do you have anything you want to say to your representatives or senators today based on your zip code? And then what they do is I'm able to text what my information, what I would like them to know, and I don't shorten my words or anything. Try to be an eloquent writer.
Yeah.
And they format it into a official letter with my address and number at the bottom, and they fax it to both my senators and my representatives.
That's pretty handy, but what are you saying in there, Samantha? What are you saying about health care?
I've been telling them that about 50% of what I've been saying is the Affordable Care Act, the way it stands now, those essential health care items need to remain in the American Health Care Act, and that the American Health Care Act as a whole needs a red pin. And I'm glad that they've decided last night that it needed revisions, but I'm really worried that it's going to suddenly get pushed through without the American people not knowing what those revisions are. So I actually use another app called Countable to keep track of what they've been doing, too, because they are moving so quickly on so many things these days. It's difficult sometimes to keep up.
It's hard to keep up, but we can hear that you're out there talking to people. I mean, Noam, this is where philosophy and politics meet in a hurry. I mean, Americans can get really focused on what it may mean to them if they know enough and the heat is high enough.
That's one of the reasons I think actually why Republicans are moving as fast as they are. Time is always the enemy of healthcare legislation.
Support for On Point and the following message comes from Rocket Mortgage by Quicken Loans. When it comes to the big decision of choosing a mortgage lender, it's important to work with someone you can trust who has your best interests in mind. With Rocket Mortgage, you get a transparent online process that gives you the confidence you need to make an informed decision. Skip the bank, skip the waiting, and go completely online at quickenloans.com/onpoint. Equal housing lender, licensed in all 50 states. NMLSconsumeraccess.org, number 3030.
Hi, it's Tom. I'm glad you're listening to this On Point podcast. Really happy to have you here. You know, a lot of people barely know podcasts exist. They've never listened to one. Here at On Point, we want to change that. All this month, we're inviting our listeners to tell a friend about a podcast they love. Do it in real life or on social media, and make sure you let us know what you're recommending. Tell us using the hashtag tripod. That's hashtag TRYPod. And thanks. I'm Tom Ashbrook. This is On Point. We're talking today about House Republicans putting it all on the line for the American Health Care Act. Trump care, Ryan care, call it what you will. We're looking at what they have hammered out today, a big, big tangle as they try to push through a replacement for what's been called Obamacare, the Affordable Care Act. Criticizing Obamacare, pretty easy. There's been a lot of it. At a rally in Louisville, Kentucky on Monday, President Trump was hard on it.
Obamacare has been a complete and total catastrophe, and it's getting worse and worse by the day. And yet you watch the fake media, the fake news, and they try and build it up. It's a disaster, fellas. It's a disaster.
Okay, easy to say, but replacing it? I mean, you be the judge. Replacing it, that's another thing entirely. Former President Obama, interestingly, out today with a statement. Today happens to be the 7th anniversary of his landmark health care law. He's saying America is stronger because of the Affordable Care Act. This is former President Obama. He says we should start from the baseline that any changes will make our health care system better, not worse, for hardworking Americans. But that is not that easy to accomplish. You can join us this hour. Where would your vote be today? Scott in Somerset, Kentucky. Scott, you're on the air. Thank you for calling.
Hi, Tom. How are you?
I'm okay and watching with complete fascination at what's unfolding today.
Okay, my thoughts and my comment is here. We hear all the Republicans say we've got to repeal Obamacare, circle the wagons, get behind this. This is what we run on. So they're trying to appease their constituent base. But in Kentucky, we have a majority of Republican voters here. They voted Trump in unanimously, et cetera. But at the end of the day, if they repeal Obamacare and replace it, they are going to underserve the poorer part of their constituents. And I hope that if they are successful in getting enough numbers to vote, that people in Kentucky and everywhere else wake up and stop voting against themselves. These sheep are being led to slaughter here, and I hope people wake up and realize how it's affecting them or how it will affect them.
Scott, I appreciate your call. Mary Agnes Carey, Kaiser Health News, is there a kind of political calculus here? I mean, that the losers will be older and poorer, and maybe they vote less, and maybe they'll be struggling with their health care and won't be thinking about voting later. I don't know.
There's the top-line messaging, like at the clip you just played with President Trump, or when Paul Ryan talks about the Affordable Care Act, where there is no doubt there are problems. There have been some incredible premium increases for this year. There are issues, to be sure. But when you look at any piece of legislation, you have to sit down and figure out what does it do to the market, what are the pros, what are the cons, and this is one of those conversations. I think one of your Samantha, when she talked about messaging Congress, and I think Scott is there as well, looking at what is actually happening. What would the change in Medicaid funding mean in your state? Noam talked about the great role that Medicaid has in nursing home care, right? It funds like 66% of nursing home care in this country.
That's a lot of people's parents and grandparents.
Right. Would the shift, what would it be like for the subsidies to change from based on income and the local prices, which is in the Affordable Care Act, to based more on age with a less of a focus on income as it is under the House Republican plan. So you've got, and all the points that Scott makes are right. This is how Paul Ryan and President Trump are trying to really push this over the goal line. This is our chance. We ran on this. We've got to do it, and we've got to do it now. And you've also got to remember the bigger picture on Capitol Hill, both President Trump and Republicans want to overhaul the tax code. That takes a ton of political capital. There's concerns about infrastructure, immigration. There's a host of other issues that they frankly want to get to because time is ticking away. So there's a lot of, don't just go to the top line headlines you hear. I think it's really important for people to kind of tune in and figure this thing out.
Republicans at risk of stumbling on this fundamental issue, health care, today. We invited the Republicans' Freedom Caucus to come on and talk about this, but I guess they're a little busy on Capitol Hill today. So let's get more granular. Let's get closer to the ground. Dr. Lena Wen joins us right now. She is health commissioner for the city of Boston, an emergency physician herself. Lena Wen, thank you very much for joining us.
Glad to be with you, Tom.
Baltimore health commissioner, if I misspoke there. So here we are, Republicans wrestling with this today. You're health commissioner for Baltimore. And what do you see on the line here? If the Republican replacement plan goes through more or less as designed, what kind of impact?
We see everything on the line here in Baltimore, in Maryland, and across the country. There's a reason why physicians, nurses, public health officials have all said that we're concerned about how this repeal plan, will affect the health and well-being of millions of Americans. I practiced medicine before and after the ACA, and I've seen how patients used to come in with life-threatening conditions that could have been prevented if they were able to access health care sooner. But people would ration. They would choose food. They would choose rent over paying for their seizure medications, their heart disease medications, and end up costing society even more when they come to the ER with life-threatening issues and actually be much less healthy for it. So I agree with everything that's been said about the impact on low-income individuals, on seniors, on mothers and children. I mean, these are individuals who are the most vulnerable in our society, who depend on our protection. And by gutting Medicaid, by cutting coverage, we are affecting these most vulnerable and generations to come. And I think something else that we have not yet talked about as much in this debate is how much the repeal will affect those individuals with addiction, with substance use disorders, and with mental illness.
How will it? How would it?
Well, we have an epidemic of opioid addiction, opioid overdose.
Yeah, we know that, but how would the repeal affect that?
1 in 4 patients who is getting treatment for substance use disorder is on Medicaid. So by gutting Medicaid and by taking away the essential health benefit in Medicaid for covering addiction and mental health treatment, we're potentially going to get millions of people who are currently getting insurance or who are currently getting coverage for addiction who are now not going to get it anymore. And for those individuals, there is no margin for error. If you are addicted to substances and you're getting treatment now and you stop getting treatment tomorrow, the only choice you have may be to use drugs, overdose, and die. At a time of a public health emergency, the last thing that we need is to further cut back services. We need to increase services, and this replacement plan will cost millions of lives.
Mary Agnes Carey, is it fair to say that this would gut Medicaid? I mean, there's still going to be a lot of money going to it. I guess $1 trillion out is a lot. I mean, is it gutting? Is that fair?
It is definitely a major reduction. But the proponents of the plan say that they feel that Medicaid does not work as well as it could, that governors might have ideas and legislatures have ideas to make Medicaid work better in their states. We've seen states go to the Department of Health and Human Services to ask for waivers, to ask for some changes. And so the proponents of the plan say that if basically you gave states more flexibility, more power, you can save the federal government money, and that states can decide for their own populations what they need to do. But as being noted, there are deep concerns about what that funding reduction would mean and what it would result in, because it doesn't seem like the demand for any services, drug addiction, opioid addiction, this kind of thing, is any less than it's ever been. It's actually quite more. So if you cut a state's money, even if you loosen some of the strings of Washington over Medicaid, some of the requirements, would a state on less money really be able to provide the services that people need? And that is the the open question.
Dr. Nguyen, Lena Nguyen, you're there in Baltimore. You're health commissioner. If Maryland had more freedom, a capped Medicaid grant from the federal government, but more freedom in how to use it, could you do better in Maryland?
We could do better if we had the funding to be able to do it. So take addiction treatment, for example. The recent Surgeon General report found that only 1 in 10 people, 1 in 10 who have the disease of addiction are able to get the help that they need. We are nowhere near capacity for treating it. So in theory, if we have much more money to be able to treat this in Maryland or in any other state, of course we can do more. But the problem is that block granting will put a cap on Medicaid spending, and we're going to further reduce coverage for the millions who need it so desperately.
We've got the president today. He is out there urging his supporters to, get in touch with their people in Congress, in the House, on getting this through. He's put up a video on Twitter asking people to get behind the plan. And he is saying that this legislation, quoting him here, is the new legislation is terrific. You're going to be very, very happy. What about that, Dr. Nguyen? That's the president's message to his backers.
Well, the message that I have as a physician who treats patients, as a public health official on the front lines, is that this replacement plan is dangerous. It will decrease coverage, it will increase cost, and frankly, it's dangerous to our national security. Part of what the AHCA covers is the Prevention and Public Health Fund, which covers about 1/7 of the entire CDC budget. Taking away this fund will decrease our ability to respond to outbreaks, will decrease our ability to do vaccinations, and will also shift funding away from prevention to much higher cost care down the line, which makes us less safe as a country and increases cost down the line as well. So that's my message to the American people, that we should be looking at what will actually affect people, how these policies will affect the health and well-being of Americans and of generations to come.
Anthony in Detroit. Anthony, thank you for calling. You're on the air.
Hi, Tom. Yeah, I just wanted to say about the process that the Republicans are using. How long did we debate Obamacare? Gosh, that had to be half a year, if not more. And this bill just came into Congress, and Sean Spicer and everyone is saying, now or never. Oh, we got to do this right now. This is the Hail Mary. And I just think it sounds laughable. It sounds like a student trying to meet a deadline with a paper. Like, I just got to do it right now. That's the way they sound with this. Like, they don't want to put in the time and make a good piece of legislation.
Anthony, let us pick it up. Noam Levy, how long did Obamacare work its way through Congress? And what is the rush here?
Obamacare was debated for almost a year and a half.
Here we're talking 3 weeks, I guess, with this one.
A few weeks. But as Mary Agnes alluded to earlier, one of the things that Democrats certainly learned debating the Affordable Care Act for as long as they did is that when you start talking about something as large as health care, the longer you have something out there, the harder the discussions become about all the trade-offs and who wins and who loses. And Republicans are seeing that in a small microcosm right now. So that's one reason why they're rushing. The other is that they want to get to other things. The Republicans have never had a particular affection for health reform as an issue. But tax reform and cutting the federal budget, two things that are sort of nearer and dearer to conservatives, are real big priorities. And they can't get to those things until they get over health care. So I think the president and congressional leadership on the Republican side want to dispense with this as quickly as possible and move on.
But other things, I mean, if you're talking about my kids' pediatric care or my parents' nursing home or grandparents' nursing home care, those are pretty big things right in front of us right now, Noam.
Well, they certainly are, and we talked a little bit earlier in the hour about the trade-off between the political imperatives that are driving Republicans and the very real impact that the policies that they're talking about would have on just these kinds of vulnerable populations. I think that one of the things that's really been lost in the debate so far, and especially as the debate turns more to how many votes are there and how terrific or wonderful will the legislation be, is an appreciation of exactly these kinds of impact. I have a story I wrote the other day, which I think is it's remarkable to me that every major organization representing patients and every major organization representing physicians are not only opposed to the legislation, but very vehemently opposed to it. I've been covering Washington for more than a decade. I've never seen something quite like that before.
Let's go to Dan in New York, Watertown, New York. Dan, you're on the air.
Hi, Tom. Thanks a lot. Howdy. Great show. Great panel, great comments. And I think these are a lot of people speaking for the average American who's going to be, quote, losing out on this. And I think the key word to this replacement plan that the Republicans are talking about is, and the OMB and all the other evaluations of experts, a lot smarter than me, are saying, quote, lose. Well, I thought we were a country of we the people, that we took care of people, and the idea of anybody losing anything, particularly health care that's tied directly to our life, I mean, I think that's pretty humbling. And I think the final summary that I would say on this whole thing is for the average American to get tuned into this, which I'm pretty sure they are, particularly those ones that are losing, and just evaluate this program from the Republicans and keep the politics out of it and just say, look, this is cruel, cold, and callous, and you guys are making a huge mistake dealing with people's lives.
Dan, I appreciate your call. Lena Wen, what do you say to the House of Representatives today, Dr. Wen?
I agree with the last caller that we should be talking about the people who are losing and whether we see this as being fair and just and moral. We're looking at low-income individuals who are going to be punished the most, who are now going to be priced out of the ability to pay for medications, pay for hospital care, who are going to become bankrupt because of something that really should be what we all should get to protect ourselves. We're talking about older adults, seniors, who are not going to be able to get things like glasses, hearing aids, and prescription drugs covered. We're talking about mothers, expecting mothers, who may not be able to get prenatal care. Babies, by the way, born to moms who don't get prenatal care are 5 times more likely to die than babies born to moms who do get that care. And we're talking about the most vulnerable individuals, those who don't have powerful lobbies behind them. But we have to remember that ultimately it is about people's lives. It's about the health and welfare of millions of Americans, and we should be the ones standing up to talk about why this is so important and why we have to protect the health and well-being of everyone. High
drama day today on Capitol Hill in the House when it comes to American health care. Big consequences as well. Dr. Lena Wen, Baltimore Health Commissioner. Thank you very much for joining us today, Dr. Wen.
Thank you.
Mary Agnes Carey at Kaiser Health News. Thank you so much for helping us understand, Mary Agnes Carey.
Thank you.
And Noam Levy at the Los Angeles Times. Thank you as always.
Good to be with you. Thanks.
I'm Tom Ashbrook. This is On Point.